Welcome to the Eye Experts. I'm Dr. Eli Sluch, and today we're going to be talking about flashes and floaters caused by posterior vitreous detachments, or PVDs.
The eye is filled with a gel called the vitreous that helps hold its shape. When we're young, it is transparent and fills the whole eye. With age, the gel starts to fragment, causing pieces to break off, resulting in floaters, which may cause blurry shadows that obscure vision. When the back part of the gel peels off the retina, usually around age 60 to 65, it forms very large floaters. This is called the PVD. Flashes of light occur when the gel starts to tug on the retina during the peel. About 2% of the time, the process can be so violent that it can result in a tear in the retina, which can lead to a retinal detachment. Otherwise, symptoms usually become less intense over several weeks. Patients who are nearsighted, had trauma, or recent eye surgery like cataract surgery are at an increased risk. These are usually spontaneous events, and there's usually nothing you did to cause it in the first place, or nothing you can do to get the gel to detach more softly to decrease the risk of tears.
Once a posterior vitreous detachment occurs, time is of the essence. It is important to promptly get an eye exam to evaluate for any retinal tears or detachments. If you have a retinal tear, it can be welded back in place to try to prevent a detachment. If you already have a detachment, it will require surgery. The main goal of treatment is to make sure the retina stays okay during the detachment process, as the symptoms tend to resolve on their own in a few months anyway. Eye exams are recommended at the first onset of symptoms and 1 to 2 months afterwards, depending on how the symptoms progress. Worsening symptoms, such as increasing floaters, persistent or new flashes, or shadows go in your vision, require very urgent reevaluation, as this may signal that a retinal tear or a detachment has formed. If your symptoms persist for more than 6 months, it is sometimes possible to use a laser or have eye surgery in an attempt to remove the floaters. If you have floaters or are concerned about posterior vitreous detachment, please make an appointment with an eye provider.